Most of the time, the viruses we deal with stay within their own lanes, but every once in a while, a virus does something what we call a spillover. This is what makes a zoonotic disease so tricky. It's a virus that usually lives in animal but finds a way to jump the fence and make a human sick. What is Nipah virus? Meet the fruit bat. It's also known as the flying fox. These bats are natural home for the virus. They carry it around without themselves getting sick, acting as a permanent reservoir in the wild. Here is why health experts are so concerned. This virus is officially classified as high risk threat. As of right now, we do not have a vaccine to prevent it, and there isn't a specific treatment to cure it. When it comes to managing the outbreak, we essentially are starting from the scratch every time. So exactly how does the virus move from the wild bat human community? It usually happens through three main pathways. Route 1, from bats, the first way through is direct transmission. In many ways, people enjoy a raw date palm sap. If a bat happens to leave behind saliva or droppings in that sap, or if someone eats a piece of the fruit that a bat has already bitten, the virus can hitch a ride directly into the human body. Route 2, the middleman. Sometimes the virus jumps from a bat to a domestic animal. This is most commonly a pig or horse. If a person is carrying or touching these sick animals without protection, the virus uses that close contact to make its move into the human population, person to person. Finally, once virus reaches us, it can spread between people. This happens through close physical contact, sick person's bodily fluid like saliva or urine. This is why healthcare workers and family members are often at the highest risk during an outbreak. What are the symptoms? The tricky thing about this virus is that it doesn't show up immediately. There is a waiting period or an incubation window for about 4 to 14 days after you have been exposed to the virus before you feel the first symptom. At first, it's a bit of wolf in the sheep's clothing. It often looks like a bad case of flu. Early stages start with those familiar miserable symptoms: high fever, pounding headache, vomiting, and a sore throat. At this stage, it's easy to mistake it for a common cold. But things can take for a turn or worse very quickly. As the illness becomes progressive, signs become neurological. You may feel extreme dizziness, intense sleepiness, or even change in mental status, what the doctors call it as confusion. This is a major warning sign that the virus is affecting them. It is the most severe cases. The situation becomes a medical emergency. The virus causes encephalitis or swelling of the brain. This is incredibly dangerous and it can lead to coma as little as 24 to 48 hours. When we talk about being a high-risk disease, this rapid progression is exactly what we talk about. How is it dangerous? Beyond the immediate symptoms, we have to look at the survival rate, and unfortunately the numbers are sobering. This is an incredibly deadly virus. To put into perspective, out of every 10 people who get sick, between 4 to 7 do not survive. This is a staggering mortality rate. But even for those who beat the virus, the battle often isn't over. Recovery doesn't always mean a clean bill of health. About 20 to 30% of the survivors deal with long-term lingering effects. These can be life-altering, ranging from lasting physical weakness to neurological and mental health challenges like memory loss or clinical depression. It is a virus that can leave a permanent mark on a person's lifelong after the infection is gone. To know how to prevent it, check this video here.